Well, when something works, it just works. And we continue to hear success stories when it comes to the Pro Adjuster and Dr. Livesay. And he is back with us this morning. This time he has brought another patient with him. This time we have Kathy Marsh, and we want to welcome both of them to Daytime Tri-Cities. Good to have you guys.
Great to be here.
And again, we're hearing more success stories from the Pro Adjuster and really different variety of stories and patients.
Yeah, I mean, we have such a broad spectrum of different cases that walk into our office that most people wouldn't necessarily think about a chiropractor about. But Kathy's been under numerous chiropractors' care over the year. But a couple years ago, she had open heart surgery, and so they had to basically crack her chest open. So she didn't want anyone, you know, squeezing on her.
I don't blame you, girl.
To adjust her. So she heard about the Pro Adjuster and came into the office, and I don't know. She's been happy. I'll let her tell her story, but we're
and I
excited.
can see why it was attractive, because you don't want to go through that bending and cracking that most chiropractors do.
Right, and when they squeeze, I mean, it was actually painful, you know, when they would squeeze on my chest. And I actually heard about Dr. Craig on your show and just called his number, and I've been with him ever since. I'm very happy with him.
Did you have back pain or neck pain?
Neck pain was the biggest problem. Yeah, the neck pain.
She had a little bit of everything. She's kind of being modest there, but she's
was she a mess?
She had a little bit of everything.
Yeah.
This side of it.
There's a little bit of the neck, a little bit of the low back, but and she does a lot of traveling too, so we're trying to keep her put together so she can go do all that.
And of course, that Pro Adjuster, were you surprised at just how easy it was?
Oh, yes. I mean, and you can tell the differences the first time, as soon as you get up.
That's great.
Yeah, it made a big difference.
And for those people that are watching that they don't know what we're talking about when we're talking about the Pro Adjuster, it's just a computerized instrument where we check the spine. We check each and every segment, and it just puts a little mechanical impulse in, it reads it, it lets us know on the computer screen where we need to adjust. So there's no guessing. It's just very objective measures. So we know exactly what we're doing, we adjust it, and that's why we get the results.
That is great. And speaking of getting results, not only are you getting a lot of our viewers, but we're also getting your mail now, because I'm getting viewer questions. And actually one of those came from Miss Carol. And I wanted you to address that, because I've had other people ask me about, you know, if they have discs that are out of place. Normally they say do not, you know, at that point go to a chiropractor. And that's kind of along the question that she had.
Yeah, we're getting questions about disc problems and also surgery. So, you know, since she had surgery, but in this particular case, she was asking about a fracture. And there's different types of fractures. There's a stable fracture and there's unstable. Unstable, you know, no, we're not going to adjust you, but a lot of older patients are coming in with compression fractures, and that's just where their spine has kind of give down over the years. And yeah, we can work around those areas. Since it's so specific, we don't have to get right on it. We can go above it and below it and make that person very, very comfortable. You know, because a lot of those patients are sitting in a chair all the time. They don't get up and move around a lot. But we get a lot of patients come in with those walkers, and they go out without the walker. So it's really, really neat.
So someone like this who might have a question, Dr. Livesay, can they just call your office and say, listen, here's my story? And if you can't, then you would just tell them, like, look, that is something we wouldn't.
Yeah, if you come in and we can't help you, we're going to tell you. We're not going to string you along, and we're going to actually refer you to the proper doctor who you need to be able to see. And my staff is very, very knowledgeable. I mean, Kathy can attest to that. We have a wonderful staff. And they can answer your questions over the phone, but then get you into the office so I can sit down with you and determine what you actually need.
And you could be like Miss Kathy here, who just, it's made all the difference, huh?
Oh, yes.
That's great. Well, Kathy, thanks for watching Daytime, and thanks for coming on the show.
Thank you.
And the new patient exam consultation, it's only $27 through the end of this month.
So the end of November.
End of November,
so
it's $27. Call, schedule your exam. That's the new patient exam, consultation, and x-ray, and your first adjustment.
All for
$27.
And I'm just guessing you're closed on Thanksgiving.
Yeah.
Okay. So Monday, Tuesday, Wednesday, Friday, it is Livesay Chiropractic. It's the Spinal Corrective Center right there on Sunset Drive in Johnson City. Thanks so much for coming on the show.
Thanks.
The preceding portion of Daytime was sponsored by